as we heard, like psychosis is a major health problem and is particularly high in South London. And what we've seen is that early intervention has proved to be really effective in promoting mental health recovery, engagement, and avoiding that social exclusion, isolation, and motivation. So in my work as a dance director, I've seen time and time again the power of dance in improving health and well-being. So whilst working with Dance United Yorkshire and building on the success of the pilot in 2013, we created the Alchemy Project, which you saw is a pioneering intervention that helps young adults recover from psychosis through dance. The action research was a co-production between Cultural and Utilities and Enterprises in association with Dance United Yorkshire and South London and Maudsley NHS Foundation Trust. The Alchemy Project involved delivering intensive 4-week dance-led interventions to young adults who were accessing the early intervention in psychosis services at SLAM. And the research that we've seen has that it's a powerful catalyst for the recovery of those service users. And distinctiveness is around the intensity of the work. So for us, winning the hearts and minds through communication was essential. So the Alchemy Project takes contemporary dance into completely uncharted territory of a frontline mental health service. It involves a way of working that is radically different from, yet complements the work that is already existing in that service. So making the Alchemy Project a success relied on getting buy-in from senior clinicians, getting the frontline teams in SLAM to really embrace the project, and winning the support of commissioners. So good communication has been critical to achieving all of this. From the outset of the project, we knew we needed to use communication to open new conversations about how to embed the Alchemy Project and get it commissioned. We knew that many people in healthcare are wary or perhaps sceptical of arts-based interventions. They often don't understand their value and impact and see them as nice to have. We had planned an evaluation to evidence impact, but we knew that we also needed something that would immerse people in the young adult's journey through the intervention. And the rigour of the process in the way that written word and an evaluation report could not. So the power of film. We had previously used short films to help raise the profile of our work and thought film was a way to go. Yet we knew a 5-minute film wasn't going to provide real insights into the project to win those hearts and minds and open up new conversations. We needed to help sustain the Alchemy Project. So from the outset, we planned to produce a long-form documentary. So you just saw a 5-minute trailer from a longer documentary. We engaged professional filmmakers to help us with the film. We included the voice of young people, as well as clinicians talking about their experiences and the impact of the project has for the system as well as their practice. We also featured national and local commentators to set the work in a wider context. Using different voices, I think, brought authenticity, and it allowed the film to speak effectively to varied audiences and connect with their specific interests and motivations. To protect the young adults featured, we had very strict agreements with SLAM. The film could not be broadcast widely, so we adopted a highly targeted approach to screenings. And this gave us some intimacy of these events and has made the screenings, I think, more powerful, and it's made it easier for us to continue the dialogue afterwards. We've shown the film in different contexts, sometimes in one-to-one meetings, other times in small or large groups, and this has presented opportunities that we would probably never have had. For example, earlier this year, we screened at the inquiry of the All Parliamentary Group, which is exploring arts and health, And a social investor at that meeting approached us to explore, could this project work in Oxford, which he was based, and of course it could. And this is still very much work in progress, but an opportunity and contact that may not have come about if we hadn't have had a powerful film. The 40-minute documentary has been really effective in winning hearts and minds. What we hadn't taken into account at the beginning of the project is that some of the audiences we wanted to communicate with were reluctant to sit through a 40-minute documentary due to time constraints. And that's where we responded by creating a short trailer to whet the appetites and to engage them in watching the full documentary. The trailer has meant that we've been able to give a taster of the Alchemy Project in more settings, for example, existing meetings, and we've learned from that and we'll apply it in the future. The film has become a really powerful asset for Alchemy, and it's helped us change the tone of conversations with commissioners and helped us to explore some of the hurdles in overcoming that. Nurturing champions has been really powerful and has been a really distinctive feature of the Alchemy Project. So we've helped work with senior clinicians as well as frontline staff to help them become communication channels for the project and come on board. So one of our champions has opened up some exciting and innovative approaches in terms of writing opinion pieces. So there's a blog that is on the Royal Society of Psychiatrists website, and that's enabled us to get really peer-to-peer approach has been really hugely powerful and crediting and credibility and insight into the project. We also have an exhibition of photos through Slam Arts Strategy. So that's positioned in Maudsley Corridor, which is in such a profiled space where you see clinicians, families, carers coming through on a daily basis. So that's given us much more exposure. And then lastly, being part of the bigger conversation, we've aligned ourselves to at the charity here, the Arts Strategy Sustainability Project, and looking at kind of how you be part of those. I guess we were in some ways, because of our film and our assets and our evaluation, we could be classed as the kind of poster girl for that particular work. But I think because we had those assets, it enabled us to align to those to that piece of work, and also to further that conversation of arts and health, and helps our own model as well. So, driving sustainability, we are still trying to we're on that journey with Alchemy to make it sustainable, but I think we're in a much better place because of the way we've used communications throughout our project. Our communication assets, including the film, has certainly opened doors, which we may have not been able to open otherwise. So my top tips for you are understand what you need to achieve, so changing the conversation and winning hearts and minds. So I love face-to-face communication in a really busy, overstretched system. I think that is such a powerful thing to, we heard it earlier, walking on your lever to kind of build those relationships. Creating the powerful content with powerful messages. So we have both robust data, people love that hard data of graphs, but we also have lots of other tools. And our champions are critical to that, so equipping them with all those different assets, but giving them freedom to communicate their story, and then seize the opportunities to align with the bigger pictures, whether that's for us working with the All-Party Parliamentary Group or the Art Strategy Sustainability Project at Guy's. Thank you.